Again, the spindle cells are merging with the normal follicles. So yeah, spindle cell metaplasia are known in case of follicular adenoma. Even this follicular adenoma can have these cells, and the moment you see the cell, you will say it's a malignancy. But no, this kind of atypia, right, bizarre nuclei, again is allowed in case of follicular adenoma. Of course, limited to a certain extent, right? Even if it is extensive, right, you can just suspect that it is a follicular carcinoma. It is a malignant condition and not a benign follicular adenoma, right? But you cannot definitely say that it is a follicular carcinoma. To suspect it's a follicular carcinoma and not adenoma, you should see thick capsule. You should see diffuse atypia, diffuse nuclear atypia, right? You should see, the growth pattern, right? High cellularity with solid or trabecular growth pattern, and you should see mitosis, right? But again, even if everything is there, you can still suspect, because to diagnose it as follicular carcinoma, you have to have this invasion of capsule, invasion of vessel, capsular invasion and angio invasion, right? Suppose it is only capsular invasion, it is referred to as minimally invasive, only capsule, right? Suppose only vessel invasion, it is referred to as encapsulated angio invasive, only vessel involvement, right? And if it is involving in multiple nodules, right, that's widely invasive follicular carcinoma. In fact, another term is also used, extensive invasion, right? They say if it is invading the soft tissue, right, that's an extensive invasion. So that's a different thing. But I want you to understand this capsular invasion and vessel invasion perfectly. Why I want you to see this invasion? Of course, the difference between follicular adenoma versus follicular carcinoma, right? One is a benign component, one is a malignant component, right? So how to differentiate? Let's see. Capsular invasion first. See, we have seen this picture n number of times. I know that, but very rarely we get we read or we get time to read this. The minute details inside this picture. So we'll begin it. Say, if I will tell, if unless and until, in one word I can say, unless and until there is an invasion through and through like this, right? It's not carcinoma. That's clear, right? So here this is, yes, follicular carcinoma, right? But here is the invasion through and through. It is protruding, but not yet. Here, not at all, right? Here, not yet, right? Here, yes, through and through. So it is follicular carcinoma, right? That is everything. That is easy. That we know. Sometimes the invasion will be through and through, and after invading, the tumor might elicit a desmoplastic response, and you might get a new thin ring of capsule around again. Now it has invaded the capsule, bridged the capsule, and you are again getting a new capsule formation. Now you tell me whether you will tell it is a follicular carcinoma or not. Yes, answer is yes, because the extra capsule what you are seeing now, that is nothing but a new capsule formation, right? Previous capsule of the tumor is already invaded, so it's a follicular carcinoma, right? So even if, that's the same thing I'm telling you, even if the tumor bud is covered by a new capsule, right, don't worry, it is now becoming a follicular carcinoma. That is one thing I want to tell. Another thing is that sometimes you will get these follicles here in the entrapped in the capsule, right, entrapped in the capsule, but these follicles are degenerated, and they are in fact surrounded by histiocytes, giant cells, lymphocytes. That suggests it is a FNSC site reaction, right? FNSC site reaction. You did an FNSC from that area has some entrapped follicles, of course, but along with that, it has giant cell reactions, right? That's the FNSC site reaction. Don't worry, it's not a follicular carcinoma. But if there are again these two entities, this F and G, please focus on them. In this F and G, wait a minute, yes. See, in this case of F, what you are seeing, there are entrapped thyroid follicles, but they are perpendicular. Can you see? They are perpendicular to the capsule. That means they are on the process of invasion. So what is the answer? Are they follicular carcinoma? Answer is no, not follicular carcinoma yet. But please do deeper section. They will ask you, what is the next step? You do deeper section, right? Because who knows, you will get invasion, follicular, frank capsular invasion there, right? But if these capsules are entrapped in a horizontal manner along the direction of the capsule, see, if the follicles are entrapped in the capsule in a horizontal manner along the direction of the capsule, it is not a capsular invasion. Let's see some picture and you will tell me whether it is a follicular carcinoma or it's just a follicular adenoma, right? Let's see. Okay, what about this one? Yes, we are seeing thyroid follicles entrapped, we are seeing thyroid follicles, a follicular adenoma, in fact, follicular adenoma and a capsule, right? Yes, and inside the capsule, can you see these things? Yes, we are getting thyroid follicles in the capsule, but the thyroid follicles are, yes, horizontal or vertical? Horizontal, right? And that is why, is it a capsular invasion? Do we need to take a deeper cut? Answer is no, it's just a capsular entrapment, not at all a capsular invasion. It is just a follicular adenoma and not a follicular carcinoma. Clear? Okay, what about this one? Here you can see the thyroid follicle and it is going through and through the capsule. I think it's a follicular carcinoma. But again, once you zoom it, once you see it, you see that in the high power, these are nothing but this site, a needle-like tract is nothing but FNSC induced tract, right? FNSC induced tract. Why? Because inside you are getting degenerated follicle, if I can write it here, inside you are getting degenerated follicles, right? Along with lymphohistiocytic infiltration, right? Giant cells also you can find, and that is nothing but a FNSC induced tract, right? And not a follicular invasion. Okay, what about this one? There is a follicular adenoma and it is invading, but not through and through. So answer is yes, it is not follicular carcinoma, but we need to take deeper section because who knows, in another plane it would have invaded, right? So yes, I will say this is a not yet category. I won't say it's no, it's not yet, but it might become. Be careful, take more section, take everything from the capsule and see if it is invading from through and through the capsule. Take deeper section. What about this one? Follicular adenoma, but now it is going through and through the capsule, isn't it? Can you see this? So it is nothing but a follicular carcinoma. Understood? Okay. What about this one? Okay, this is definitely follicular carcinoma. This is the capsule and it is penetrating the capsule in the form of multiple nodules. So which type of follicular carcinoma? Widely invasive. Widely invasive because it is invading in the form of multiple nodules, isn't it? Okay. So that's regarding the capsular invasion. Now regarding the vascular invasion, usually students commit mistake because they don't understand when to say it's a vascular invasion, right? See, to tell it is a vascular invasion, the first criteria is the vessel should not be inside the neoplastic follicles. See, if the invasion in this vessel, will you say it's a follicular? Will you say it's an angio invasion? Answer is no, right? For the invasion but if the vessels are entrapped inside the capsule and the cells are invading, then it is angio invasion, right? That is one criteria. Along with that, I have to zoom it, otherwise you cannot see this one. Yes, see this. The criteria says it should not be here. It should not be, the vessel should not be within the tumor. That is one criteria. Second is that if the tumor is penetrating the vessel which is there in the fibrous capsule, right? The tumor part has to be lined by, I will make a thin one. Wait a minute. The tumor part, if you can see, has to be lined by endothelium. Very, very important. Very, very important. Can you see a orangish hue? Yes, it is nothing but the endothelial lining present around the tumor part. Here also you can see, right? The follicles present inside the vessel are even surrounded by an endothelium, right? Not just the vessel, even the follicle part is also surrounded by endothelium. That again is suggestive of angio invasion, right? Now, if it is not surrounded by endothelium, see, there is no surrounding, there is no orangish hue. There has to be this one. What is this? Fibrin thrombi, right? So either the follicle has to be surrounded by endothelium or there has to be associated fibrin thrombi. Then only you say angio invasion. Of course, if it is going to a vessel outside the capsule, again definitely it is angio invasion. But if it is just present inside the vessel and it is not surrounded by endothelium, see here, no surrounding. Can you see any surrounding? No, right? No surrounding. Then this is not angio invasion. Understood? I think I am clear, right? It should be clear. Angio invasion, to say that, there has to be lined by endothelium. If not lined by endothelium, there has to be association with any thrombi, right? So that's when we say encapsulated angio-invasive follicular carcinoma. In fact, the number of vessels invade, that also is prognostically important, because if invasion is less than 4 blood vessels, then this is follicular carcinoma for sure, but the risk of metastasis is less. The risk of mets is less, right? And if it is invasion is more than 4 blood vessels, then there is higher risk of metastasis. Understood? Understood the difference? Okay. So let's see some picture. Yes, this is a follicular adenoma, and this is a vessel, right? Now you see the follicular adenoma is going into a vessel, right? Going into a vessel, but the vessel, if you can see, is just, the follicular adenoma is just touching the inner aspect of the vessel and not invading it. That is why it is not an angio invasion. Any doubt in that? Not an angio invasion. To tell it is an angio invasion, it has to invade the vessel, right? Okay, here we have some tumor fragment, follicular adenoma, like neoplastic follicles, and now you can see it is a vessel. This one is a vessel, the large one, if I can write it here, this the large one is a vessel. But is the tumor person is lined by endothelium? Answer is no. If no, it is again not an angio invasion. Understood? Okay, let's see. Okay, here we get the tumor part, and the tumor part is also surrounded by this structure. What is the structure? Endothelial lining. Same lining that is surrounding this vessel is also lining the tumor. that's an angio invasion. Understood? Okay. Again, here you can see this is the vessel lined by endothelium. I don't know if it is visible, the arrow mark. Yes, that's the endothelial lining, and the same endothelial lining is also lining the tumor person. That's why it's an angio invasion. Again, here we have a vessel, the large vessel, the large one. This is the large vessel, and in the large vessel we have the tumor fragment. Okay, we have the tumor fragment, and this tumor fragment, oh my god, that's not lined by endothelium now. See, the tumor fragment is not lined by endothelium now, but it is still associated with fibrin thrombi. Can you see this fibrin thrombi? And even if it is not lined by endothelium, but still, just because it is associated with fibrin thrombi, it is satisfying the criteria for angio invasion. Clear? Now you won't make a mistake to identify capsular invasion to identify angio invasion, because it is very important.